Thank you. Okay, so yes, as Joe just said, I'm from the NHS. I am the lead data scientist there and mostly cover applied AI at the moment. However, today I'm not going to be speaking in my role from the NHS. I'm going to be speaking in a separate role, which I'll tell you about in a second. You've also heard there that I'm technical, and yeah, I'm talking about intellectual property today. So hopefully I'll be able to describe why I'm doing that in a little bit too. So yeah, I have to do the caveat first. The views in this slide pack are not expressive of NHS England. This is my personal view as an expert in synthetic data, privacy enhancing technologies and healthcare innovation. And the two are very much overlap, but there's some gaps at the end of the slide pack that are not signed off, which is why I'm speaking on my behalf. Okay, so why am I talking about this anyway? Well, I'm technical through and through. And as you say, I've been around for quite a while now. And the trouble is that you keep hitting that technical isn't enough. You actually need to be aware of a lot more than just the technical solutions in order to actually be effective. And in order to see innovation happen, I've spent the past 5 years desperately trying to connect proof of concepts to live tools. And this gap in between them requires a lot of knowledge, which is not technical. A lot of the wrappers about medical devices, about intellectual property, about privacy, about all sorts of different things. And this is one area that I've had to go into. And basically, I'm going to share my sort of thinking and my wrapper with you today. Now, from what I heard as I just walked in, and from what I know about Joe, there's a lot of linkage in the room, I would guess. This is linkage light, but hopefully it will bring a whole series of other thoughts and considerations for us to discuss throughout the day. Okay. Right, let's pick up the central tension. So this was already started to be addressed, but I'm speaking also mostly on health data, but I'm sure you can apply this to many other data modalities. Health data is simultaneously a patient's right. It needs to be held private. It's a public asset with the NHS, the amount of data that we've got, and it's also a commercially sensitive resource. And how we balance these for trying to achieve innovation whilst maintaining the intellectual property of this is quite a difficult area. So on the innovation side, you can say, well, firstly, we've got this amazing asset, 70 plus years, longitudinal data, entire population. This means we should use this asset. There's such value in it. We've also got, we've seen that life-saving potential of this data, and with some of the technologies that are being promised, we should be seeing AI-driven drug discovery, for instance. We should be seeing a lot more of this now than what we currently are seeing. And what are the hurdles which are blocking that? And then the public good mandate. We've got all this data. It is, frankly, our role to use this data for the public good and not just to sit on it. Our roles as data custodians is not just to lock the data away. It is to use the data in an appropriate way. Okay, but then on the other side, well, patient privacy must hold. Not just because it is their right, but also as soon as you start to reduce patient privacy, reduce trust, you see more opt-outs, you see the data eroding, and all of your value starts to disappear. The commercial IP must be clear. Companies, pharmaceutical investors, research collaboratives will not want to come and use the data if it's not clear what value they can get out of it at the end, and if it's all a hazy set of legal parameters. And then confidential data must stay confidential. There has to be very clear ways of keeping trade secrets and patents, as well as the actual data privacy, all integral throughout. So what do we need? We need to handle privacy well, we need to handle IP well, and in the middle, we need to handle the benefit and governance of all of this well. Well, this is simple. Here is the optimistic, naive guy from the XKDC comment. This is myself a few years ago. Technical solutions will solve all of this. So let's do the first one, which has already been mentioned. Let's just anonymize the data, and we'll just use that. Because once you've anonymized it, it's fine, there's no privacy concerns. Well, no, that's wrong. Anonymization is a spectrum, and the threshold moves. The threshold moves not just for different data and different tasks, but as we see technology developments, we see that threshold move. I hope most people will be aware that there was some work done which showed that 80% of individuals in the US can be re-identified just off 3 fields, which is found in all data sets. And this led to the the census data, people were able to actually work out who was who on the census data and send them emails saying, that's you, which was quite unnerving. Anonymizing also doesn't actually remove many of the intellectual property rights that come with the data. It deals somewhat with the privacy, and that deals somewhat with the ethics, but it doesn't actually deal with most of the IP issues. And there's some data in healthcare you just can't anonymize. You can't anonymize genomics data. As soon as you anonymize it, you lose the value. And that's the same with quite a lot of data. As you add the noise to it, you lose the very value that we're trying to use. And as I said at the start, data custodians, it's our job to appropriately use the data, not just sit on it. Okay, what else can we do? Well, let's get consent. We'll just get consent from everyone and then not worry about that, because once they've said we can use the data, we can just get on. Because frankly, talk to the public and you'll find that they want their data to be used. They want people to make new research. And if you've got a certain condition, the vast majority of people say, use my data so that you can do great developments so that other people don't have to suffer this. But consent has to be specific, it has to be informed. And as soon as you go to specific consent, it's very difficult to use that data for general research purposes. And it has to be informed. How can you inform someone about their consent when you're not even sure what the technology is going to be like in 5 years that you're going to apply to this? So it becomes quite a burdensome process to get to the exact level of consent that you need. And as we start to have that anonymization spectrum again, to sort of say your data is going to be used in this way, but not that, actually, it might not be true in a few years' time. Okay, I'll have to speed up. Let's just wrap it in a good cloud. You know, we've got ISO 27001, which means that we have perfect security on our cloud. You don't need to worry. As long as you've got your 5 safes, you can work in there. The trouble is that security and governance are not the same thing. Just the analogy is, just because you've got a locked room, anything can happen in that locked room. And so actually you're not doing your due diligence there. You've just made a nice lock. Let's federate it. I generally believed in this 3 years ago. I thought we just federate everything, keep the data where it is, we move the models around. Well, it's been shown that federating models leak in terms of the weights. You can do membership inference attacks and find out about the training data. Exactly how big a risk that is for certain tasks is unknown. And so people are leaning on the let's not do it at the moment. Federation still has massive potential, but it needs really strong considerations in it. It's not just the leakage, it's also, have you ever tried to do a joint intellectual property agreement with different people federating into one data set or creating one model of many different data sources? That is a nightmare. Yeah, it's extremely difficult to actually derive value commercially off that. Okay, we can just open source it. We put the model out, no one gets the IP, everyone gets the value. Fantastic. Unfortunately, that's not quite how it works. You can see that with the foundation models, which we've currently got. People put them out openly. Well, what happens is you take that model, you apply it on some proprietary data, and the value is in the data, not the model. And you can't open source the data. So therefore, you've just taken someone's work, very quickly applied it on proprietary. You've now got all the value. They don't have anything. That is happening in the large language model world. And then this is the only one that I've not gone for. In the past few years, self-certify. I've put it in because that was a tactic that was done quite a few years ago in NHS Digital, and that failed in quite drastic ways, because that's led to some of the care.data side of things, which I won't go into. Okay, let's move forwards because I'm going to massively overrun. Firstly, a slide just to give us a bit of the regulatory landscape. The green on the right-hand side, this is the push. These are the documents which are saying, let's innovate. You know, get out there, UK, and actually do something with your data. So just for your reference. And then on the other side, we've got the law. We've got GDPR, data protection, the Data Act 2025, and the Common Law of Confidentiality. So we need to balance these. That push to do stuff with doing it in the right way. You've also got some guidance there, the 5 safes, the IA white paper, and of course, Data Guardian and Caldecott principles. So this is the landscape that we need to work in. It's a difficult landscape, and I'm going to come back to it. But first, I'm going to go on a bit of a random side note, because health data is special. Every data scientist says their data is special, but I think my data is more special. The reason that health data is special is really because of legacy infrastructure, unfortunately, which I'm not going to bore you with. But let's actually do it in terms of, let's put a patient at the center instead, and try and think through the issue in that way. So here we have Alex. Alex is completely fake, obviously, but Alex has been referred for ADHD. they've been prescribed a medication. There's been an emergency admission, possibly because of the medication they've been prescribed. They're now on a waiting list for further management. They've got other comorbidities alongside ADHD. There's some historic mental health diagnosis. And whilst waiting for this, they're frustrated. They think they might have been discriminated against. Okay, so to simplify it down, they've got community to primary referral. They've got an emergency stay with a possible causal link to a reason. We've got waiting list dynamics, we've got comorbidities, and we've got possible discrimination dissatisfaction. As a data analyst, data scientist, you look at that, you go, there's masses that I can do here in terms of being able to help this patient. Okay, I just need their data. So you can see where I'm going with this. Here is their timeline. They're born, you get an ONS record. You go and register yourself at your GP, you get put on something called PDS, you get your vaccinations, that's an extra record on your GP. As you go forwards, Alex has had a 111 call for something, maybe for asthma as a kid. What have I got there? CTV. So they've had some diagnosis of some form. They've had a prescription prescribed. Maybe it's the medication for ADHD, for instance. And this is logged in some of those medication tables at the bottom. There is the mental health record. So they've had an assessment and something's come up there. So they're now added to the junior mental health. They've then ended up having various diagnoses to look at their condition. So they've got some PSG on their monitoring. They've got some different X-rays and tests. Various different interaction points are being logged. Okay, then you come to how you're treating them. So they've got outpatient appointments. They've had some genome sequencing to look for a genetic condition, perhaps. And all of these, again, are all filing down into national data sets at the bottom. There's the emergency admission that they're currently concerned about. There's a 999 call. They've gone in. The light blue APC table is them in hospital, various signals. Okay, this is a rich set of data here that we've got to work off. And you then have a pseudonymization and aggregation layer down to this, which might also have an anonymization layer at some point. But where is that data? So this is why healthcare data is so interesting. We have such value in the longitudinal data, and yet it's all over the place. As a national analyst, I get to see some of that box there. So I certainly have quite a good range of things to see, but you can see that the ICB, the trust, they all have different views. And so if I say, well, from the national perspective, what can I see of their pipeline? Well, not that pipeline, pathway. What can I actually see? Not that much, really. And as linkage, you'll know that linking these together is even harder than just trying to collect all that data. Maybe we go to the hospital instead. Well, they've only got this sort of a view. They're not seeing all of those gaps, all of the different connections of the pathway. So this is why single patient record would be so key. So who is actually looking after my data? I'm leaking all this data as I go through the healthcare system, but who's actually looking after it? And who's getting the value back for me? Yeah, I mean, this is a question which is going to hopefully come up a few times today, but as the patient, as the individual, who's fighting for you to get the value? Okay, what protections are there? As your data is collected, it says it's not owned. What I mean is the IP is not owned. So the data is owned, but there's no IP particularly on the raw patient data. But as soon as you start to curate it, you link it, you do something to it, you get some database rights. As soon as you start to apply model, you start to get some copyright. You might get some trade secrets. Let me just flag these up. There's 6 different elements that we commonly think about for intellectual property. So the green and the gray, these are about database protections. Your yellow patents and your pink trade secrets are obviously about the outputs, 2 different ways that you can protect your knowledge there. You've got your copyright is on everything, and then confidential information, the way that you process things. And all of this needs to be considered. And as a technical person, you don't care about this to begin with, not until it suddenly hits you. And one of my pushes to my colleagues is to be aware of these sorts of things, not to necessarily be an expert, but to be aware of them. Okay, when do these apply? I'm going to use, this is the data user journey, which is something that's been used in EHDS, European Health Database, comes from the TEADAS project. I'm just going to translate this into a UK context. So you've got 6 different stages there, and you won't be surprised by those stages. Data discovery, permit application, data preparation, data provision, data use, and results output. Looks nice and simple. And there's different roles which are played alongside this. So what I'm going to do is I'm going to go through each stage, quickly sort of say, this is what the stage is, and then we're going to look at what's the IP and what are the tools which can help us. Because the meat of my talk now is what are the technical tools that can actually help us to sort of monitor all of this IP and the privacy and everything like that as we go through. So data discovery. This is where you're searching HDR UK or you're searching some form of metadata store to find your data. You're reviewing the documentation, you're trying to work out if this is a data set that you can use for your research study. And you've got these different roles involved in that. I think it's fairly clear, so I'm just going to keep going. I can always come back to these. So what sort of IP? Well, there is a bit of copyright in the metadata store, but honestly, that's quite small. So it's really about these database rights. You need to have a very clear understanding of what rights each of these data sets have attached to them and therefore how you can and can't use them. So what tool do we need? We need clarity. Now, if you've worked across multiple different trusted research environments or secure data environments, you'll know that there's different metadata tools that actually bringing all these together. It's quite complicated, quite confusing in terms of exactly how you can use the data, and especially when you start to link across different data sets, what are all the different constraints and controls. So we need a way of showing that which is a bit better. And I would suggest we need something which is machine readable. The suggestion which is being put forwards in a couple of places is to use open data rights language. This is quite a heavy solution though. Let me just show you an example, very simple example. This is about publishing a book. And we see that we have an asset which is called Why Cats Sleep and We Don't. We then have a person, a party, Alice. And what we have in between those is we have an action. And basically Alice is allowed to print Why Cats Sleep and We Don't, and she can print it up to a constraint, which is up to 3 times. So all of that information on the screen just dissolves down to that little sentence. It's very clear, and it means a machine can read that, but it would take an awfully long time to create that. So there's a definite balance in terms of if we should use this or not. But that is a W3 standard of how to contextualize rights on data, and I think it's very promising. Okay, so we move to the second stage. We've now got an understanding of what data there is and how we can use it. We now need to put our permit application in. This is the longest stage. It's got all sorts of different people putting in their 2 pence, lots of different data roles involved, lots of review bodies. The trouble with this stage is what do we need to do from an IP point of view? Well, we need to know the future. We need to know exactly how this data is going to be used, what it's going to create, who it's going to benefit, who all the controls are going to be. And honestly, we don't usually know a lot of that. We usually have an idea what we want to do, what question we want to answer, and it might turn into something, but we don't know the full extent. And so you can end up with some very burdensome conversations going backwards and forwards, trying to work out what is the future for this particular project. What IP is involved? Well, everything, really. I mean, the main ones are these 4, but you just need to consider everything that could possibly happen at the permit application stage. Because if you get it wrong here, if you say you can do something with the data, and then later on down the line, you find out, oh, we said you could use it for that because it's anonymized, but now we find your model is too sophisticated, so it's actually going to leak privacy. You've already given the permit application. So what do people do? Well, they go back to, well, we just won't give the application if there's any uncertainty. And that's where the actual talk comes in. Balancing innovation and intellectual property, it's all about that risk. People are not happy. Our risk appetite is very low for our data. What tools and techniques, this is what I'm trying to think through, what tools and techniques allow people to increase their risk threshold because there's clarity? So what would give us clarity here? Okay, you need templated data sharing agreements. That's already there. Everyone has those. But then there's this idea of smart contracts, and especially smart contracts that incorporate the ODRL language that I just showed you. A smart contract which is able to say, well, in the situation where you're just doing some exploration to see if this model works, it's under these, the value sits with these parties. But at the point where this becomes a commercial asset that you can put a patent on, the smart contract essentially updates itself to say, well, no, this is how you use it. So you have to encapsulate what you want in your data, and then your smart contracts are updated as the end product becomes clearer, so that you still maintain throughout the project an idea of who owns what sort of value there is. It's not a particularly new idea. Most implementations of it use blockchain, and people get very caught up in the technicalities of that. But honestly, don't worry about the blockchain. Worry about this idea of a contract which doesn't define all of the parameters, but instead defines the value and then updates as the value essentially becomes clearer. Okay, third one, data preparation. In the data preparation task, we are applying our pseudonymization. We're in the trusted research environment. We've got our wranglers doing the work. The researcher hasn't got the data yet, and they're preparing it and getting the extract together. This is where your linkage comes in. So what have we got here? We've got various IP involved. We've got the database rights. You need to know what you're doing, but you're also creating new intermediate assets, and those assets themselves have database rights. And how do you actually capture those rights? The techniques that you apply, the way that you do your anonymization and your linkage, if you use synthetic data, how you are producing that itself has copyright on it as well. And some of the processing steps might fit into confidential information as well, especially if you're dealing with higher modalities of data. So what can we do here? Right, so the idea is, when you're preparing the data, is there a way to keep tracking of exactly how the data has been used? You can do this by monitoring every step and being very closed down on exactly how it's been used and doing it in a manual way. But are there ways to actually keep tracking? Can we put the governance into the data rather than have the governance as a layer around the data? And this is where digital watermarking basically says, well, let's put a watermark on the data. This picture is ridiculous. I don't know why I show this, but essentially the original image here, smiley face, and then we've applied a watermark. I have actually done this. There is a watermark in there. And the way that it works in an image is you take something like the red channel and you add a couple of digits to the red channel. The human eye can't see the difference, but I've just put a whole piece of code into my red channel. And so I can then essentially put a big hash number, and that hash number will be able to encapsulate which IP address has opened the data, what changes they've made. So you put your version control into that hash, you put your access into that hash, and you've now got, I can see exactly who's changed that picture. And you'll recognize this sort of language from a lot of stuff with a lot of the conversation about AI on artistic rights. Well, can you do that on tabular data? It's an open area of research. It's not proven yet, in my opinion. It would be fantastic if we do. But there's all sorts of stenographic techniques that you can apply, which persevere through different transformations of the data. So you can actually link that data to something else. You can apply a model to it, and that watermark can persevere through that. But there's a limitation. Fragile under heavy pre-processing. And what this means is, if you are a motivated actor, you can get through that watermark at the moment. So it's not a foolproof method at all. At least it's not proven yet, but I think there's massive promise in it. The other thing, I have put synthetic data generation in there because I work on synthetic data a lot, so I have to advertise it constantly. There's a couple of our GitHub repos. There's a couple of IHI ones, which I'm particularly watching because I think they're great projects to be aware of. But we can use synthetic data to help a lot with the data preparation in a variety of different ways, to do with speeding things up, but more than that, to do with robustness checking and bias checking, and making sure that when you do receive the data, you have a product that is robust to edge cases that can deal with the bias appropriately. But that's a side point. I just stuff synthetic data in there because I have to. Okay, number 4, data provision. You've now provided, how do you provide the data, sorry? How do you give the data? If you're in a trusted research environment, then perhaps it's just you put it in a workspace. But this is all about making sure you've got your 5 safes completely intact. What technical measures are there in there? You need to be thinking about your database rights and your regulatory data protection, but what tools can we use? Okay, privacy enhancing technologies. So once we've got that data in place, there's a whole suite of technologies, either algorithmic or architectural ones, which will allow people to access the data in different ways. We're very interested in differential privacy is everywhere, but we're quite interested in homomorphic encryption at the moment. That allows you to send data to a third party without ever decrypting the data, so they can do processing on it and send you back the process results without them ever seeing it. That's fantastic. That means we can use cloud resources very efficiently. And homomorphic encryption, again, it's a research area which is seeing great bounds at the moment in terms of actually getting it to a point where it is efficient. Because the trouble with it is it's very computationally heavy, very expensive at the moment. So trying to come up with a value chain that uses it is quite difficult. And then the architectural pets, you've got your federated learning there and use of trusted execution environments. And usually the solution to data provision is a whole range of them. It's never one pet on its own. It's usually 2 or 3 coupled together. And we've got a couple of pilots if you're interested in talking more about that. And the other thing that we do at data provision stage is, can we use intelligent agents? Can we use some of the agentic AI that is being bounded about? Can we actually use it for a good use case? One of those use cases might be as simple as monitoring, especially if the intelligent agent has that ODRL right at the beginning, so it knows what the data should be being used for, especially if it's got the watermark, so it's able to see who's done what to the data. It's then able to track in live exactly how it is happening and if it's adhering to the smart contract. So the intelligent agent would use all of the other principles that we've already put in place in order to monitor efficiently. But maybe that's overburdening. Maybe we're just shoving AI into something that doesn't need it. It's a bit of a debate. Okay, number 5, data use. Data use is actually, obviously it's the model, or the analysis itself, but in terms of the IP, this is where a lot of the IP is actually obviously generated. It's where you're creating your model, creating a new tool. So there's a whole series of things in there. What controls do we have? Not many. And that's fine, because this is where your researcher, your user, is doing their work. You should already have all of your controls in place. So I've just put in here persistent logging. We're using our 5 states, we're using our sticky data policies, our smart contracts. We're using our intelligent agents, our watermark monitoring, we're using the pets, we're using everything at this stage, but there's nothing particularly new because you allow the researcher, you allow the commercial partner to do the work at that point. Then the results come out. So final stage, we need to check the results, don't we? We need to make sure they're approved. We need to make sure we've got proper cell suppression and everything. There's some additional IP generated here in the end product. So we've got that on the left side, right side. What techniques? So the techniques that I'm particularly interested here, machine unlearning. And the reason that we're interested in machine unlearning is because of Article 17. We need to be able to take a patient out. If they opt out, if they say, I have the right to removal, we need to be able to do that. And not just in our databases, but do we need to do it in the products that are made off the back of those databases? Currently, the thinking is no, because that's just not achievable. That's beyond what we would be able to do, so it's not reasonable. But the question of, if you have an AI model trained on your data and you're then seeing you're not happy with that as a usage, can you say, I need to opt out my data from that model training? At the moment, we can't do that. And so you end up with some very burdensome contracts around the use of model and the sharing of the model in order to try and deal with it. What machine learning tries to do is it sort of does a membership inference attack, but it essentially can question the data from a whole variety of different angles, questions about the individual, and you're then able to identify where in the model that individual data point is appearing. So I have information about my data point, I attack my model to see if I can find it, and then I remove that from the embedding, I remove that from the model. That sometimes leaves a gap, which is just as disclosive, so you then have to disguise that gap using a bit of noise. But it's quite an interesting set of thinking, and the question for maybe this room is it over the top? You know, should we just accept that once the model's trained, it can be used under certain constraints, or should we have techniques that attempt to try and have that provenance and take out and have that traceability? And then disclosure control. manual or automated disclosure control, self-suppression, aggregation, privacy methods, lots of different things that we use there, which I'm sure the room is well aware of. The limitation there, AI model weights are an unknown egress point. If you have an AI model and you say to a disclosure control checker, is this safe? They currently have no guidance, as far as I'm aware, and no tools that they can apply to that to say, yes, that is safe. So that's an issue then, because we don't actually know if our models are able to leave our environment. Yeah, that picture at the bottom there is sort of adding differential privacy noise to an individual until you can't tell that they are the same individual. So that's quite an interesting paper if you want to see a good example of that. Okay, putting it all together. I've said a couple of times it's a combination of things, and that's exactly the same message here. This is my stab at it. It's certainly not a final version, this, but I'm starting to think, what are the different layers that need to be in place? Well, you do need your strategy. You do need your sort of push from your big innovators saying we should be doing this. You need your mandate. Once you've got your mandate, you need your constraints, your legal and contractual. So you've got the laws that we flagged up earlier, but you've also got these technical tools which are allowing you to make sure you're fitting within that. We need our process and journey. If it's the 5 safes, the data user journey, or some other AI governance model, that needs to be clear. And then technical enablers, the PETs to allow the movement of data, possibly the digital watermarking to allow that provenance after it leaves your environment, and those intelligent agents to monitor whilst it's in your environment, what's happening to it. And then your assurance not auditing, you've got your login, your disclosure controls, and then you've got these very new areas of unlearning and AI output checking, and if those are appropriate or not. So all in all, that gives you your mandate. It allows you to express your POLIC, that should say policy. Then you've got good access control, your usage is monitored, you can trace your outputs, and therefore your IP obligations are enforced. I've used the word enforce, that's bad, because the whole point of this is we now have a way of, well, we don't, as you'll see in a second, but there is a way of ensuring your IP is moving with the data. And if it's clear and if it's usable and tractable, that means you can move through this much faster. And that is what then brings you innovation. The idea is it's not a balance between innovation and intellectual property. It's much more, in order to innovate, you have to set up your intellectual property correctly. Okay, last 2 slides. However, we're not ready. Most of what I've shown you is pipe dreams or current research. Going to the right-hand side, technical watermarks are fragile. I've mentioned that one for motivated actors. Intelligent agents, they're only as good as what they're trained on. If there's a novel attack, they'd miss it, which a human wouldn't. So should we really rely on those? Watermarking is absolutely intention of unlearning. If you do some unlearning, you actually destroy your watermark, or you leave the person in the watermark and actually you can then do an attack on the watermark to find the individual, which is, frustrating. Your process and your environment, this ODRL idea and the smart contracts, they only work if you've got people that are willing to work with them. So if all of your parties are willing to adhere to them, it's fine, but you can just ignore it. There's no real enforcement. Let's then go to the strategic ones, because these are the big ones. The benefit sharing and value return is not clear. And this should be one of my main points, actually. Unless we have at the heart of all of this a very clear understanding of where should the value sit for our data, none of the rest really works. So unless you can say the value sits with the patients, the value sits with the data controller, the value sits with the national body, the value sits with the commercial user, the value sits with the person who is assuring and monitoring the tool, wherever that value sits, we have to have that quite clear to understand how to do value sharing across different parties. But whilst it's a case of everything's up in the air and every party gets to have something, you actually find that no one gets anything. We need patient public voice in IP. I'll come back to that in a second. And we need interoperability of IP registers. Unless there's a way of connecting IP to data, again, it's quite meaningless. So you actually need a national registry, which just says these models are based off these data, because that then allows you to do traceability of individual data across multiple products. Okay, so overall, we need a legal wrapper that has teeth Most of the reason this doesn't work is because we're getting there with the technical element, but the technical is not backed up because it's so novel and new by the legal. And what that means is you don't have standards to work to for anonymization. You don't have standards for synthetic data. You don't have a way of enforcing ODOL and smart contracts. You don't have a way of using a watermark in a legal case to actually hold someone to account. We don't have those examples yet. There's an awful lot of things that needs that legal record with teeth. I've mentioned the provenance registry to define the chain of custody, and then harmonization, which is always difficult to do in health and in any large data. Final slide. I'm not actually expecting questions because I've given you too much. I will happily take questions, but I think it's probably going to be more discussions afterwards. So I thought I'd give you some questions instead for us to discuss, if you like. So the questions that I've gone for, there's a lot of unknowns, there's a lot of answers that I can't give. For instance, who should own the intellectual property created from NHS data? What would FAIR look like? My team and I have spent many hours over coffee talking about how you would bring the data back to a patient and if that's achievable and appropriate in any way. Can we build technical systems sophisticated enough and fast enough? So, okay, I've shown you something. How long will that take to build? If I am perfectly right, which I'm obviously not, it will still take 5-6 years to build something like that and more time to validate it and show it. In the meantime, what are we doing? Because the AI use case is making everything more enhanced in terms of its risks, and it's here now. So can we actually build something that can do the job fast enough without losing public trust? Can consent ever be truly informed given anonymization isn't absolute? That'll be an interesting one to discuss over coffee. And the rate of technological development. And because I believe there's academics in the audience, I've gone for, should research on public health data be open by default? Can we design IP frameworks that make openness the path of least resistance? So again, something else that I'd be very happy to discuss. No, thank you very much.
Brilliant. Thank you, Jonny. So we have 5 minutes for maybe 1 to 2 questions before we have our break.
Yeah.
So I'm predominantly clinical anyway, but I suppose the data as you because as a junior doctor, one of your jobs is to go and be a very talented data analyst. And I qualified 20 years ago. So back then, there was less digital resource available to just take it into resource. There's a lot more reading paper, turning it into something. And if you were good at it, you made a jolly good job of trying to do data quality, which the vast majority of my peers probably don't. I'm going to say that.
Yeah.
And so that's interesting. That's what you want to see as a frontline clinician looking after an individual patient outcomes. And I guess I'm going to ask the question. For me, it's always seen backwards and try to extract that timeline from the multiple sources that you've shown, so basically the other way around. And most of your talk is really good. It's kind of what the outside audience isn't here to hear about the thought that goes into trying to compensate, which I think most people really probably spend most of the time doing compensating for that deficit in the source data. So if that's the case, would there be any merit in trying to look at doing it the other way around? Because when you try to operational data, you know, NHS, and now some of my time is spent on a full role as a clinical safety officer. I do deployments on NHS primary software implementation. They all fall down on the same problems. I know Joe, and I'm here because someone said go talk to Joe about names and things like that. And that's where the operational stuff falls down, things like data balances fall down. Can't find anyone that really wants to do that, whether it's the NHS, the government, the academic world. But I just asked the question, does that have merit? Would that change the sort of problem you're trying to solve?
Okay, so 2 answers. One is on linkage of single patient record, which I'm going to leave for later talks. But the one I'm going to pick on is the value one, because I mentioned that we need a clear understanding of where is the value of data. The reason I've gone for that is nationally, we set up our data not to monitor our population, but to make sure the money and resources flow to where they're needed. That's why the data collections exist. All of our quality is about trying to understand where exactly in the system do we need to have resources to enable the system, and it's system focused. And that means the value of our national collections is in supporting the system. None of that has mentioned the patient. It affects the patient, obviously. And the idea is that the centre supports the systems, and then the systems look after their patients. But the systems are, sorry, I'm just going off into a rant now. The systems are their own legal bodies, which don't have access to all the different data sets they need to build up the patient record. So where actually is the motivation? Where's the benefit, the value defined that says having a patient record where you get all of your data and you can essentially give that as you wish to different research bodies, to different products in order to get better outcomes for yourself? That doesn't exist. And I wouldn't expect it for the population. It's too heavy a burden for an individual to try and understand exactly their data. But there's no one that's what this entire Alex's story is trying to show. There's nowhere that who actually is caring about the value of my data and how I get the value back from that. So basically, I've just said the question back to you, I suppose. I've not actually answered it. The solution is to have not a single patient record necessarily, but to have the data collection pivot from system level to individual level.
Because that's the kind of example I'm trying to ask is that I'm using four sort of things. You've got sort of individual care, you've got public health data, operational things, and research, the kind of four big domains of use. I don't think the individual care has ever been proprietary with design, and the value proposition then for the patient should sit with them. Like as a clinician, I think most patients probably the primary reason we have the data in a health setting is to look after that individual. And we've never, I don't think, really built the system, even going way back. They're all administrative, and now they've become very research and sort of public health focused. But design seems to sit with the wrong value proposition, even though we get all those benefits that we're trying to sort of sort out in terms of if you get value out of it and IP and funding. You know, I mean, I'd say it's an NHS system. You throw it back in and reduce our taxes, for example, to I think would be the value proposition. But for me, if all the system ever did was let me look after one patient, that would be good enough. I mean, probably with a better basis for the kind of broad concept that people might understand. But I just want this to be about me and both. Yeah. Would that work, and where could we have that conversation? Because as I said, I don't think we've had it.
Okay, I've just remembered that in the room we have UCL LLC colleagues who might have a better value proposition for that than I do, but we can come to that later if you like. But
so I'm Andy Boyd, I'm director of UCL LLC. UCL LLC is a platform which is attempting to, well, it actually is now linking research participants, consented participants in longitudinal studies to their diverse routine records. So our objective really is to tell Alex's story and to map out not only Alex's clinical pathway, but map that against Alex's social pathway through education, through into employment and or not employment, and then into old age, to then support the studies who are collecting data directly from Alex and Alex's family on Alex's story outside of the lived experience represented in their routine record. The routine record is only a fraction of what defines Alex or what motivates Alex or what drives Alex's behaviors. So our value proposition is to provide as many lenses on Alex's story as possible, but to align them all into that lived experience pathway. How we then sort of like convert that into public benefit or particularly more complicated commercial innovation, it goes back to Jonny's story. We've got a long track record, 80 years of using this for public benefit research. That bit we're comfortable with, but then how we manage IP and the tensions between individual rights and societal benefits as that data becomes commercialized or innovative methods like AI modeling are used, which probably do have strong benefits, but also risks and profit-making motivations. I don't know the answer to that yet. That's what we're testing at the moment. That's our sort of edge of where we understand what we can do comfortably and what we're having to explore. And Jonny's really well articulated a lot of the issues and tensions that we're exploring. So I'm not sure whether that helps. It probably led to the same question mark at the end of the sentence.
Well, this is why I put those questions up at the end, because unfortunately we're in the territory of we need the discussion live and tractable in people's minds because there's still a lot of unknowns, but there is a big need.
Great. Jonny, if you could pop the questions back on the screen, maybe you could use your memory and take it to the break. And there are coffee and biscuits outside. We have a short break of, let's say 10 minutes, and then we'll be hearing from our public contributors already online.
Who owns data in contemporary issues?